Hey guys, how you doing? Brian Ortega here, the Insurance Authority. This video, I'm going to go over short-term plan options and why I pretty much would never recommend these in almost any situation. For the most part, if you're going to get one of these, you might as well just have no insurance. Um, the only time I can really think where you might just want to get one of these is if you literally only need coverage for like 1, 2, 3, 4 weeks, maybe 5 weeks. Um, you know, uh, in between jobs, if you know that you have another plan starting soon at a specific time, like it's set in stone, you know for a fact in 3 weeks your new employer plan is starting. Okay, fine, you can look at that option just so there's no gap. But we'll show you kind of what that would entail. I just put in my information here for the purposes of just pulling up some plans. So this is going off of my date of birth and my zip code. Obviously, based on your zip code and based on your age, the premiums would vary. Okay, so these are short-term plans. So we'll just look at the top two, cheapest and most popular. So looks pretty affordable, $53.62. You think, okay, I'm doing good. That's really cheap. I can afford that. Let's see what would actually happen when you go to use the plan. So, the big thing I see is a crazy deductible. $12,500 deductible before the plan will start to actually contribute and pay a portion of your plan. That is very high. When is the last time that you spent more than $12,500 on health insurance? Most of you watching this video probably go once a year, twice a year, get your physicals done, your MAMs, your PAPs, and you're done. The kicker is when you normally talk about deductibles, it's generally an annual deductible. With short-term plans, as you can see here, it's a 6-month term. So what that means is after every 6 months, that deductible would actually reset. So if you extrapolate that for the year, it's actually in this case, what is that? A $25,000 deductible, which we can all agree that's just ridiculous. And then you have a cap on how much it covers, 2 million. To someone who may not be well versed in insurance, that may not be that big of a deal. You're like, that's a lot of money, 2 million bucks they'll pay. That's a lot. But the only time this plan would actually kick in due to the deductible would be in the event of something catastrophic. Um, that would be able to eclipse that deductible. And if the event happened where there was a catastrophic illness or injury, those can get up into the multiple millions of dollars. So you don't want to have a cap. You always want a plan that's going to be unlimited. Okay, next it's going to be an EPO. So that's even an EPO. So that's even smaller than an HMO and a PPO. So I made a previous video kind of comparing those, but basically you want to have a PPO at all times if you can. That way you can go to any doctor and you can go in or out of network. If you can't get a PPO, then at least get on an HMO. It's going to be a smaller network. You do have to stay in, have one primary doctor, and you can't go out of network, but it's still going to be the second largest network with the most doctors outside of a PPO. Then it goes into stuff like EPO, which is even more limited, more restrictive. You'll have to search farther, maybe drive farther away to find a doctor who will accept it, who will be in network. And then your in-network repricing and discounts won't be as high. So that's another negative, that it's a very limited network. So right here, the coinsurance is 30% after you reach the deductible, meaning the plan is going to pay nothing until you reach this number, because the coinsurance, which is the portion that they will pay, does not kick in until you hit this. If you happen to hit this, then they will pay 70% of your costs, and you will pay 30% of your costs. You will continue paying that 30% until you get all the way to $22,500 out of pocket. So if something catastrophic were to happen, which is really the only time this kicks in, you still have to come out of your own pocket $22,500. Maybe you do, maybe you don't have that much money lying around, but that's obviously really on the high end. Prescription drugs are not covered. Primary doctor visits and specialist doctor visits are not covered, also subject to the deductible. So and then hospital services, same thing. Uh, Deductible, after deductible, after deductible, after deductible. So these plans literally cover absolutely nothing until you pay the deductible. And what happens is I'm talking to a lot of people daily, 200-300 people daily. I'm trying to call them, trying to help them out, sincerely helping them out. And a very common response, oh, I already have insurance. Or I already got it covered. I found something. And this is what they're talking about. They found a cheap short-term plan, or somebody sold them a short-term plan, and they think they're good. They think they're covered. They think they got a bargain. And this, unfortunately, is what most people, when I reach out to them, I'm calling them, trying to help them get into an actual real plan with real benefits. They just brush me off. Again, I have coverage already. I'm good. And if you had this plan, I'll ask you guys, do you think you have coverage? Would you consider this plan having coverage? Doesn't cover your prescriptions, doesn't cover your doctor visits, doesn't cover scans, blood work, imaging, hospitalizations until you hit that $12,500. I wouldn't consider you having coverage. You have literally nothing. These are bottom of the barrel plans. You don't really get much worse than this. You can check out the most popular, but probably going to find the same thing. So this one's going to be $10,000, so a little bit less than this one. Still a short term, 6 months, so it's really $20,000. Still has a cap on your coverage. This is a short-term indemnity plan. So it's not even real insurance, it's just indemnity, meaning they're just going to pay out some fixed amounts up to whatever your cost of the procedure is at a very limited amount. Co-insurance is going to be 50% at the deductible, so same thing. Once you go ahead and reach a deductible, then you have to pay 50% of all of your costs until you pay up to $20,000 in total. Again, very high. Prescription drugs still not covered. Okay, so that's rare. On this one, a doctor visit, they do a $50 copay. That's really rare. You almost never find that with these. And for the specialist, let's read here. I'm curious. Limited to one for 30 to 90-day coverage. 2 visits for 91 to 80 coverage. Okay, so you get 2 visits. You're limited to 2 visits at a $50 copay. So that's actually really rare. You almost never find that. So we'll give it that. And of course, for hospital services, you're paying everything until you reach the deductible, and even once you reach it, then you're still paying another 50% of the cost. So I think we can agree that these plans are really poor. They cover virtually nothing until you hit these ridiculous deductibles. So if you think you have coverage and you have a short-term plan, you don't have coverage. You need to get onto a PPO network, which if you don't have an employer plan, then the only other way to get that is by looking at different private options, because the marketplace or Obamacare are going to have HMOs there and EPOs. So you have to find some type of private plan that will offer the a PPO option. And if you can, you want to get onto a medically underwritten plan, because with those, if you can get approved on the front end by being healthy, then you're going to get superior coverage. Because on plans that are medically underwritten, you are being put into a plan with other people who are also healthy. Therefore, it's a lower risk pool, lower cost to the insurance company, which equals lower cost and lower deductible to the consumer or the client, which would be you and I. And then I guess to wrap up the video, the last thing I will say with the short-term options is it's going to be that You can get into the plan up front. They're not going to medically underwrite you on the front end, meaning if you go to apply for any of these plans, you're guaranteed to get approved. There's no like application process or approval process. You'll just simply be put onto the plan. With that said, what these are notorious for is once you start to go putting in like a claim, then on the back end, they'll do some underwriting and they'll pull up all your medical histories, all the dirt, and if they find anything they can use against you to say, oh, well, you had this condition back then or this surgery back then, anything that they can find to use against you to allow them to say we're not gonna go ahead and pay your claim. And you never know that's gonna happen because it's not medically underwritten on the front end. So even after you pay that ridiculous deductible, there are, and you can look online, multiple horror stories and situations where the claims don't get paid out or very minimal because they end up again pulling records on the back end and using it against you. Whereas, just one more time, I want to make sure this sticks with you with the medically underwritten plan, since they're doing all the underwriting and checking your medical history up front and doing a health assessment up front. Once you're on the plan, you know you're good. You don't have to worry or be, concerned that claims not going to be paid out. So with that said, hopefully that kind of shows why you don't actually have a plan if you have a short-term plan, and why you want to stick with a private, under medically underwritten plan if you can. Obviously, if you're on an employer plan, then you're good to go there. If you are interested, as far as how you find these private plans, a lot of them you have to have a licensed health advisor to be able to go ahead and have access to these, and they'll get you linked up. That's what I do. I can get you help with both public and private plans, but obviously I do specialize with the private options, especially if you're healthy, especially if you're self-employed, and especially if you're making too much money to get a subsidy on the marketplace or Obamacare. So if you fall into any of those categories, I'll definitely be the best option, be able to find the best option for you. I'm confident in that. So with that said, that's pretty much the whole video. My name again is Brian Ortega, the Insurance Authority. Give me a call 407-922-1048. You can do a call or a text, or you can go to my Facebook page, which is www.facebook.com/the Insurance Authority. Talk to you guys in the next video.